Rock and roll. Okay, so thanks so much for listening, and for the seniors out there that are used to Medicare and You. I just have to talk a little bit about healthcare because it's such a pertinent issue. So, to the gentleman that was in my boardroom the other day, or my conference room, whatever I call it, he's like, just stick to our topics, all right? I will. I'll try. I'm retiring soon. What do I do? That happens all the time. People are now working past 65 because they have to. Their spouses are retiring. The gentleman was 70. You have to turn on your Part B, as in boy or babe for the ladies' case, but boy, blue, anything with a B. You need to get A for free, but you have to pay $104.90 for your Part B. You have to turn it on. I give the woman at Waterbury Hospital a nice compliment. So-and-so, so-and-so. I think her first name was Chris. But she was fantastic. I call her up. I coordinate with her. I send her the form. You need to get from the Social Security Department, or from my office if you want. I could always email you one, mail it in the mail, or fax it. Application for enrollment in Medicare, the medical insurance program. So it's a form that is 2 pages, request for employment information, and the application for enrollment in Medicare. This must be signed by your group administrator or the HR director, whoever that may be. It has to be signed in order for Social Security to recognize that you have credible coverage. The word credible coverage means that your employer provided you with coverage. Anybody who's retiring or turning 65 soon, please call in 203-757-1320. I won't beg, so I'll keep talking. But this is a pertinent issue. And I have now a lot of clients that are calling the office just to ask for questions. And the questions need to be fielded here on the airwaves, because then everyone can hear the answer. I like people calling, but as far as the answer, it's better if the masses, the thousands that listen, get the answer. So you're turning 65. You're turning 65 this August. You get 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday to turn on your Part B. If you do not, you can only do it next January, and the coverage doesn't start till July. So make sure you realize that you will be penalized if you don't turn on your Part B, if your initial coverage election period comes up and you don't have employer coverage. And also another thing, people say, well, why do I have to get Part D? D for drug coverage. You will also be penalized for that if you do not get it and you didn't have it through your employer. If you don't have credible coverage through your employer and you wait, you will be penalized 1% per month of the national average, which is $32.34. So about 35 cents, 32 cents to 35, depending on where you are in the country. You will be penalized per month for every month that went by. Maximus. I was trying to ask Chris Melee from the Access Health, but he didn't listen to me, or he was just talking. We missed it. Maximus is based out of upper state New York. They are the reviewing agency, so they review whether you're going to get penalized or not. Okay, so the scenario is you're retiring. You go to your HR person, or you go to your employer, or you come to me. We sign the form. You go down to 51 North Elm Street. Some people apply online. I'm not a big, huge fan of the government website, which is socialsecurity.gov. I like people. I like to talk to somebody. And I like for that person to give me verification that he or she and I went to the office, and we get verification that, yes, this is the date it's being turned on. Some people are falling into the donut hole right around now. That happens all the time, especially around this time of the year. You've gotten a drug. You didn't even realize it's the cost of the drug. 2 people, a client of mine just called in, her parents or her parent-in-laws just fell into the donut hole. The donut hole, if anyone has any questions on that, I'll explain it. It's $2,950 worth of drug costs. You fall in, you end up paying. Another thing clients always ask me is, can I get out of this plan? No, you can't get out. There's a bit of a quandary going on right now with United Healthcare that they pulled out so many physicians. I had a client in Northville get hurt and has got in a car accident and he broke his hand. It was a nightmare finding a hand surgeon that would take United Healthcare. So the only way you can change your plan during the year is to qualify for what Christopher Melee was referring to, a SEP, a special enrollment period. And the only way to do that on Medicare is to qualify for a QMB. The QMB is a qualified Medicare beneficiary. So the QMB program is something that you apply through the Western Connecticut Agency on Aging or my office. If your income is $27,000 or less for a single, $37,000 or less for a married couple, you qualify to get extra help. That extra help, I love it. I always get my clients this, and they're very, very happy. It gives them the $104.90 back in their Social Security check. That way, if you are in an Advantage plan, you can go from one Advantage plan to the next Advantage plan. But you cannot, if you don't have the QMB or the Medicare Savings Program, it's referred to as both, you can't change in lock-in. Lock-in is after February 14th through the remainder, December 31st of that year. So we are having some trouble. Unfortunately, Yale New Haven Hospital pulled out of United Healthcare. The word network optimization is really not what's happening. It's just big monster insurance company being smart with their dollars and being, unfortunately, physicians bill a little bit too much that they shouldn't be doing so much billing on the particular item, a test, a second test, a third test, with dye, without dye. So I think United Healthcare felt in their minds that they were going to disenroll a certain number of doctors and then have those qualified doctors have to reapply. If your physician does not take United Healthcare any longer, they can reapply to get back in the network. It's actually very simple. Simply call your physician up, tell them to contact provider relations at United Healthcare and to fill out the painstaking, whatever, probably now 15 pages at this point. Some physicians just ignored it, but it's actually happening, and now deep into mid-May, it's causing some serious troubles. So they're a great carrier. I love United Healthcare. I always did. I sold the product well. It's just this was a definite bad year. This was a bad year for this to go on. Okay, secondly, Medicare supplement. There's a new player in town called combined insurance. We are going to look at it. I'm not going to sell it as much as I'm going to look at it first. I always tell my staff, I care about ratings and who pays the claims. I'll look into it. I'll check into it if it's a little more affordable. But it's not something I would just switch a client. Boom, here, just take this because it's $10 a month cheaper. If you have a United Healthcare Medicare supplement and you're paying somewhere around $220 or $200 and something per month, you are not affected at all by this network optimization. You have what they call a Medicare supplement. You can go to any physician or hospital that takes Medicare assignment. So you're not affected by that. You will just simply home, do your yoga, breathe deep, and know that I'm in a good plan. Why is it so expensive? Because it has Medicare paying 80% of the claims, and the supplement pays the 20%. The reason the Medicare Advantage plans are $0 per month is because you've given up Medicare and you've gone on the carrier's list of doctors and hospitals. So that's one of the reasons Anthem Blue Cross Blue Shield, their Advantage plan, they have completely pulled out of New Haven County in general for the year 2014. And it's been a bit of a disaster because the carriers that now with United doing what they did to the network, the carriers that are really left are Aetna and Connecticut. Connecticut is a very strong company, great customer service. They're local. They're Connecticut only. So if you're not going to travel, not going to go anywhere, aren't a snowbird, that's perfect. For the Aetna, Aetna's having a little trouble. By May, we're finding out there's some formularies that people don't love. They were getting the prescriptions at a much different price. Whether it reduced, I don't want to say the word discounted, but they were getting it at a more reduced price on another carrier. Aetna's formulary is costing a lot of money.